Hello, my name's Dr. John Steinberg. I'm a consultant psychiatrist and I'm the medical director of the Caloundra Private Clinic, and I'm also a consultant at the New Farm Clinic, which are both Ramsay Health facilities. Today I'm going to talk to you about a psychiatric illness, schizophrenia. Schizophrenia is a complex psychiatric illness that can begin with many symptoms. It affects the way you think, the way you feel in your emotional state. It affects the way you perceive your environment. It affects your cognitive function, so it can affect your intelligence. And it affects the way you relate to people around you. There can be many forms of schizophrenia. We don't think of it in terms of one illness. It probably is made up of multiple illnesses that are caused by the same problem in the brain. So schizophrenia is defined by the type of symptoms that you present with. So you can present with various symptoms of abnormalities of thought. So you might believe, for instance, that people are persecuting you or trying to hurt you. And that might be what we call paranoid schizophrenia. People with paranoid schizophrenia might also have what psychiatrists call hallucinations. And these are experiences where you detect a sensation, such as a voice, that is not caused by a specific thing in your environment. So there's no one sitting there talking to you, but you hear people talking. And those people might be commenting on you. And these symptoms can be extremely distressing. We have catatonic schizophrenia, which is an extremely severe form of schizophrenia, where it affects your motor state, where people can't move properly, and they can be almost frozen in their motor state. So they're almost like a model or a waxy figure. Disorganised schizophrenia, where people's thoughts are very disorganised. So instead of thinking logically with connection between your thoughts, it becomes what we call woolly or dissociated. There are also other forms of schizophrenia that may affect your mood. So we might talk about schizoaffective disorder. So instead of also having the so-called psychotic symptoms that I've described, such as hallucinations or delusions, abnormal thoughts, you also might have mood symptoms as well. So you might become extremely depressed or very high or elevated in your mood. So there are various types of schizophrenia, and there's also severity of schizophrenia too. Some types of schizophrenia are not very severe and only last for a short period of time, maybe 6 months of illness. But other types of schizophrenia go on for much longer, and it can be a lifetime of illness. These symptoms can be at their worst perhaps in those first times when people are most distressed by them, and often they're treated, and sometimes people never have any more episodes of those types of most severe illness. They're treated, they get better. Sometimes people, if they can only be brief and then resolve, but there's a group of patients who develop those symptoms and they don't resolve. So they just keep going maybe even for the rest of their life. They can be worse maybe for the first 5 or 10 years and then reduce in intensity over time. That's why we need to pick these symptoms up early so that we can manage them and treat them as best we possibly can, and to engage people to limit the damage of those so-called negative symptoms over time.